So with the Sickle Eye Project, it's the first and largest multi-center study in the United Kingdom on sickle cell retinopathy. Other countries like United States, for instance, they have guidelines that suggest yearly reviews and so on. We haven't got that here. We haven't got enough evidence. So the Sickle Eye Project is designed to, one, help us understand what the proportion of the population with sickle cell disease is that has visual impairment due to sickle cell retinopathy. So we want to know what that number is so we can plan for them, so we can support them, so we can identify them, so we can get funding to do research to justify that this is a big concern. So that's one. The other objective is to correlate the stages of sickle cell retinopathy that they do have with their systemic symptoms, such as the number of times they're admitted to hospital and various markers in their bloods, to see if we're able to use any of that to predict one way or the other, using what we see in the eyes, what's happening in the body. Then the third goal is to determine the impact of sickle cell retinopathy on vision-related quality of life, because, believe it or not, there isn't anything in the literature that is published on how visual impairment affects quality of life in sickle cell disease due to sickle cell retinopathy. And then lastly, we're also looking at how acceptable it is to patients with sickle cell disease to attend eye clinics to have eye scans regularly, because it's important that the fact that we think it's a good idea doesn't mean it's a good idea. It's important that the patients also think it's a good idea, which then means they're engaged and they will attend and they'll get benefit from it. Longer term, the next steps of that study are to use the images that we collect to create a large, labeled, artificial intelligence enabled database to help us predict who is likely to develop the severe types of sickle cell retinopathy, so we don't have to screen everyone. We know that not everyone will lose sight, but we currently don't know who is at risk and who isn't. So if we're able to use our database to refine who is likely to be at risk, then we can actually focus the resources on those who need to be seen and let everyone else get on with the rest of their day. So ultimately, that's the aim. Those are the big aims we have for the Sickle Eye Project. It's not just me, it's a large consortium of people. We have 18 sites across the United Kingdom, and we have international collaborations as well.